Back on Talk of the Town, and always good to have a familiar face here as we have Greg Gion, who's back from Medical Art Prosthetics. And Greg, welcome on back.
Well, thank you.
Yeah,
good to be back.
Yeah, always love having you on because it's always such interesting stuff. The pictures always tell 1,000 words as well. And we're going to talk a little bit about the specialty of facial and somatic prosthetics. So what are somatic prosthetics?
Right. We've talked about facial prosthetics, and just to bring the two together, I'm going to show you some quick examples of facial prosthetics are, as we've shown before, nasal, orbital, and auricular prosthetics. So this would be an example of a nasal prosthesis. This would be an example of an ear prosthesis. These things, you know, go on the patient, come off. They're not permanent. And then the orbital prosthesis would be an artificial eye with the surrounding tissue. Somatic prosthetics, which we'll talk about today a little bit, are those parts of the body that can be restored with prosthetics, including the hands, feet. Sometimes breasts are included in somatic prosthetics. It's kind of a general, all-body, all-inclusive for all those parts of the body that need to be restored.
Okay, so we're talking extremities then, I guess.
Yeah,
right?
I think for my specialty, silicone somatic prosthetics, we're talking about hands and feet.
Okay.
And I think the important thing to remember is that these are the visible parts of the body that people see in the public. So when they're to be restored, sure, we want them to be functional, but the real priority is that they look natural. So I think what we'll do is look at some photographs rather quickly.
Absolutely.
So yeah, I'll blast through these really quickly so that we can get an idea what these are. So example number one here is a amputation of part of the hand. So we call this a partial hand prosthesis. So this is a silicone restoration. The person would slip on. She could go about her business and blend in.
So it looks like it almost goes all the way up to the wrist then?
It does, exactly. This is an example of just an individual finger prosthesis, and I think in this case I just added a before and after. So this is the prosthesis itself, and there she is wearing a prosthesis in place. So the idea is that if you're not looking for these on a person, you're not going to notice it.
Right. Well, they end up looking so natural. I guess so much of it, too, is how much you have to focus on the color of it and getting the skin tone right and texture, yeah.
And so we even get into the full hand prosthesis where there's been an amputation at the wrist.
Okay.
And this is a much larger thing, but I actually work at the university where we can scan and mill a 3D, a mirror image, so we can use the hand, the unaffected hand, as a model, mirror image it, and then create a prosthesis that's almost a perfect mirror image.
Amazing.
Right down to the skin folds, wrinkles. So the idea is the person can wear their prosthesis out and look normal. And then this is an example of obviously a foot amputation or toe amputation where, same thing, we end up making a silicone prosthesis that just looks really natural.
Wow. Yeah. And I would imagine, I mean, that could be from so many things. You might work with patients that are diabetic, maybe?
Exactly.
Yep.
Circulation problems or traumatic amputation.
Can you explain a little bit, I guess, the basic process of how these devices are actually like fabricated? How do you do that?
Right. Well, the process starts off with an evaluation. We often then take impressions of the affected part, and then also impressions of the unaffected hand or foot. And we use the unaffected side as a model for the prosthesis. And then we go through a series of check sockets, in other words, basically pieces of silicone that go on the residuum, the affected part, to make sure the fit is good. And then we work into the actual sculpting and shaping of the prosthesis so that it looks natural and add detail. Ultimately, we make a mold, and then we fabricate the part in silicone. The patient comes back, and then we do our final finishing, tinting, sealing, and delivery. So it's a rather straightforward process.
Yeah, I think that too, there's a lot of benefits for these patients now. What are some of the benefits for them actually getting the prosthetics done?
Well, the obvious benefit again is so that they can put their prosthesis on, go about their business, and not have their difference become the topic of every conversation, having to explain how they lost this body part, how they're going to be treated. They can blend in, so to speak, and feel comfortable. And this actually does become an important thing in people's vocations. You know, if you're an actor and you have a part of your hand amputated, wearing a prosthesis, allows you to become an actor and not have that become the focal point. A lot of examples like that.
Greg, always interesting. The stuff is always amazing, and as always, we have too little time to even talk about more. We appreciate you coming in.
Yeah,
thank you so much. Yeah, and we got more Talk of the Town right after this here on Channel 57.